Let us try to understand what are omega 3 fatty acids. Omega 3 fatty acids are alpha linolenic acid, eicosapentaenoic acid, and docosahexaenoic acid. Why are they called omega 3? If you look at the structure of alpha linolenic acid, you can see that there is a double bond in the 15th position. The last carbon, this side, this is the omega carbon. Omega is the last letter of Greek alphabet. So omega 1, omega 2, omega 3. So there is a double bond in the omega 3 position. So that is why these are omega 3 fatty acids. We will discuss about the structure of omega 3 fatty acids in a separate class. Now we are going to understand the clinical aspect of omega 3 fatty acids in this video, right? You should also know what are eicosanoids. Eicosa means 20 carbon, right? So, eicosanoids are 20 carbon compounds, right? How are they produced? They are produced from membrane phospholipids. You know, the cell membrane is a lipid bilayer. It has phospholipid. So these phospholipids are acted upon by an enzyme called phospholipase A2. So this enzyme, it releases fatty acid. So what is this tail? So this is the fatty acid, right? So fatty acids are released. Look at this. So fatty acids are released. These fatty acids, they can undergo two pathways. One is cyclooxygenase pathway. In this pathway, prostanoids are produced. The other pathway is lipoxygenase pathway. So this is known as Cox pathway. This is known as LOX pathway. Very easy to remember. LOX pathway produces lipoxins and leukotrienes. Let us focus only on prostanoids in this video. We will discuss about eicosanoids in a separate class on a different video. Prostanoids include prostaglandin, prostacyclin, and thromboxanes, right? So this is what I want you to know. What are omega 3 fatty acids? They have a double bond in the omega 3 position. What are eicosanoids? These are 20 carbon compounds. So these are paracrine and autocrine messengers, right? So what is the role of these messengers? Look at this thromboxane. Thromboxane is a platelet aggregator. Thromboxane A2 is a platelet aggregator and vasoconstrictor. Whereas prostacyclin, which is PGI2, this is a vasodilator and it inhibits platelet aggregation. So this thromboxane A2 and prostacyclin, they have opposing action, right? This much basic is enough to understand this topic, cardioprotective role of omega 3 fatty acids. So what is this fatty acid? This fatty acid can be omega 3 fatty acid or omega 6 fatty acid, right? So based on that, we have series 2 prostanoid and series 3 prostanoid. Arachidonic acid, which is a omega 6 fatty acid, is the precursor of series 2 prostanoid, right? Whereas your docosahexaenoic acid and eicosapentaenoic acid, okay, DHA and EPA, they are the precursors of series 3 prostanoid, right? Look at the structure. See this? Why they are known as series 2 prostanoid? Look at the number of double bond. There are 2 double bonds. So that is why these are series 2 prostanoids, thromboxane A2, PgI2. So the number 2 indicates the number of double bonds. Whereas look at this PgE3. What you are saying is PgE3. 1, 2, 3. There are 3 double bonds. There is no need to remember the structure. Just understand that why they are known as series 2. 2 stands for the number of double bond. So thromboxane A3 and PgI3. Clear? Right. So as I have mentioned, thromboxane A2 and PgI2, they have opposing function. Thromboxane A2, it causes platelet aggregation and vasoconstriction, whereas PgI2, platelet disaggregation and vasodilation. So normally, there is an equilibrium maintained. There is a balance, homeostasis is maintained during hemostasis, right? Let's compare the series 2 and series 3 prostanoids effect. If you look at this, see this. Thromboxane A3 is weaker than thromboxane A2. So that means thromboxane A3 is a weaker platelet aggregator, and weaker vasoconstrictor. Whereas PgI3 is more potent compared to the PgI2. So PgI3 has more beneficial effect compared to PgI2. Thromboxane A3, as you can see, it is weaker than thromboxane A2. That is also good for us. That means less platelet aggregation. Fish oil, it contains eicosapentaenoic acid, EPA. So this EPA is a omega-3 fatty acid, right? So intake of omega-3 fatty acid, it favors towards less platelet aggregation and more vasodilation. So the net effect is beneficial, right? Which is the first thing in blood clotting? Platelet aggregation. That is the first event, right? So platelet aggregation is prevented. Why we give aspirin? Low dose aspirin is going to inhibit thromboxane A2 synthesis in the platelets. So low dose aspirin is beneficial. So in the same way, fish oils, they are beneficial. So in my book, I have explained this clearly. You can see that thromboxane A3 is a weak platelet aggregator compared to A2. PgI3 is potent platelet disaggregator compared to PgI2. So the net effect of intake of omega-3 fatty acid is the promotion of platelet disaggregation, otherwise inhibition of platelet aggregation, right? In addition to that, there are something called resolvins and protectins. They are produced from DHA, docosahexaenoic acid, right? So EPA, DHA. These are the two important omega-3 fatty acids that confer cardioprotective effect. So this resolvins and protectins, they are involved in resolution of inflammation, right? So inflammatory state, that is also lead to coronary artery disease. So omega-3 fatty acids, they produce anti-inflammatory mediators. Is this clear? So they push the equilibrium towards less platelet aggregation, more vasodilation state, and also they produce certain messengers which has anti-inflammatory function. So that is why omega-3 fatty acids are cardioprotective. So I have explained everything in this book, Biochemistry for Undergraduates. If you have any doubts, feel free to ask me in the comment section. Happy learning!